Welcome to the Prospective Doctor Podcast, where we will provide essential information for pre-medical students and those already in medical school. Listen each week for tips on how to improve your application and gain an acceptance to medical school.
Hey everybody, welcome to the Prospective Doctor Podcast. Thanks again for joining us. This week, we are flipping the tables a little bit. Dr. Marinelli hosts things and is able to ask questions to a whole bunch of awesome guests. But today, I'm actually going to ask questions to Dr. Marinelli. So I'm Dr. Mehta, for those of you guys who haven't heard my voice before. And we're excited to lead you guys through a couple of important ideas for gap years, as well as just in general, your undergrad years, in terms of extracurricular activities. So, I mean, these are questions we get all the time. And today, we want to really focus it around research and that elusive research experience, whether it be lab or clinical experience, publications, how many do you need? How should I write about them? These are all some of the things that we're going to try to cover today with Dr. Marinelli. So without further ado, I want to welcome Dr. Marinelli. And Dr. Marinelli, thanks for joining us today.
Thanks for having me. I'm excited to talk to you about this topic.
Awesome. So, Renee, we get so many questions every single year about research, right? And I think it's nice for us to just take a step back and forget the individual questions that people have. But you did a lot of research as an undergrad, and I think you even took some time off between med school and between undergrad and med school to do research. Can you tell us a little bit just about your experience?
Sure. Yeah, thanks. So I did do quite a bit of research in undergrad, and the majority of my research experience was actually in clinical research. When I was in undergrad, I was working for a neurosurgeon, and I kind of just serendipitously fell into this position. And when I was there, he started to run 2 clinical trials and put me in charge of those. Also, while I was in undergrad, I did do some basic science research, but I was never super involved in that. I had learned the basic lab techniques and things like that and saw a project through, but it wasn't a big role. I never had a publication or a presentation. However, the clinical research side, as you mentioned, I became pretty involved in that. And then I did take a gap year between undergrad and medical school where I continued to work with the neurosurgeon and on those clinical trials, which was just a great experience. It really actually helped me develop a lot of professionalism skills and a lot of patient communication skills, because when I enrolled patients into the trials, I worked with them very intimately. We went through the 25-page consent together very thoroughly. We talked at length about what the trial would include. I followed them all the way from surgery to post-op, and we followed them actually years after post-op. So it was just a really intense but in-depth experience as well, as far as how research works and how it can directly impact both the physician and the patients.
Cool. Let's take a step back for a sec, because this is a question I get a lot, which is, what is actually the difference between basic research and clinical research? Do you have a kind of a understanding of that you give to your applicants?
Yeah, so I mean, I think with my experience in particular, and probably in general, you can apply this. So basic research is going to be something that you're going to spend most of your time in a lab. This may be related to patients. So maybe you're studying patient blood samples or tumors or something like that. Or it could be far removed from patients, but may have some type of clinical applications in the future, or some type of just really improving scientific knowledge. That could include like studying, mouse brains for a model for Alzheimer's disease or something like that. But pretty much in basic research, you're going to be in the lab and you're going to have a project that has applications to patients, potentially to patients. In clinical research, you're actually working with patients and testing different treatments on patients themselves. So this could be drug trials. So if you're testing a new drug, that could be a clinical trial. Also, another clinical research aspect like I worked in was surgical treatment. So this was a neurosurgeon, so they were actually testing new surgical devices on patients. So that's kind of my experience, and I think the general understanding of the difference between the two. But if you have anything to add, Dr. Mehta, to that, I would love to hear, how those definitions also are present in some other areas of clinical medicine.
Yeah, I mean, so when I think about it, I really think about clinical research just like you do, which is I find that a lot of students who are interested or a lot of researchers who are doing clinical research are typically much more involved in clinical medicine, right? So they are actually seeing patients on the wards, they are taking care of patients on an everyday basis, and maybe their research is a little bit less quote unquote hard sciencey. And so, for example, they might look at clinical outcomes of patients with GI bleed, just as a very, very large example. And then they may go through a bunch of charts and understand kind of what happened with the patient who came in with a GI bleed of one sort or another and what pathway or what medicines they got. Or maybe they were looking at, is octreotide really helpful in patients with GI bleeding? And so they may look at a whole bunch of different patients, either in a retrospective or potentially in a randomized control trial setting where they study them actually in the future and assign them to one group or another. All that is sort of under clinical research. Mm-hmm. And then I consider basic research a lot of the stuff that has the crazy acronyms that you may not even understand once you're out of, undergrad and out of that medicine. So, hey, how does EPOC SU8, how does this tiny little enzyme contribute to cell death? Or how does glioblastoma multiforme form in a cell bath? I'm making up words here in a lot of ways, because a lot of times when I read clinical basic science research that students have done, it's actually beyond me because I'm not an expert in that tiny little area. And that's often what happens. And so the research that people are conducting is incredibly important when it comes to basic sciences and laboratory type work. These are the translational researches is often done on a cellular or a molecular level, whereas clinical research is done on the human level, right? They're done on actual patients as opposed to maybe cells or mice or something like that. And so maybe that's one way to break it down.
Right.
I get a lot of students who kind of always are thinking about what should I get involved in or what makes more sense to me. And I think that's a question that comes up a lot. And my answer to them is usually either one is okay to do. And I think both could have tremendous value on your application. I think that clinical research, sometimes it's easier to hit the ground running, right? You probably need a little bit less biological or chemical background. You maybe don't need wet lab skills that you would need in basic science research. Mm-hmm. Yet at the same time, maybe it's easier to get a publication or two in the clinical research sphere. That said, basic science research is incredibly valuable and something that if you can do well, you will make a huge impact on your application. I don't know if you have additional thoughts on that.
Yeah, and I agree, but I also agree too that I've seen a lot of medical schools that really, really want to see some basic science research on there. And I think maybe the reason for that and could be just that it's more kind of the raw scientific process, so to speak. I mean, you really start from scratch of designing an experiment, talking about how and developing your methods and testing your hypothesis that you created, and then actually seeing the results through and defining your results. Whereas a clinical trial or clinical research may be something that's already kind of established or you're just joining the project. I think it's a little bit more rare for a student to design and execute clinical research. Whereas, that's a pretty common thing that they may do in basic research.
So it sounds like you have some great insight into why a medical school might really like or want to see some basic science research on the application as well. That's a really great point. I wonder, how do you recommend your students kind of get the experience? How do they get involved in research? Where can they go? Who can they contact to sort of start the process?
Yeah, that's an awesome question. And I think the key here is just being proactive. So trying to find research positions right away. So if you're a freshman and you're hearing this podcast, then probably once you're done listening, you should look into some of the departments within your college to see if there's any available research slots. I see a lot of applicants that go to really big schools and they just didn't really look for research too much, or they waited until, their junior year or something like that. And they're just not able to find research positions because there are so many students seeking these types of positions. So I recommend starting early and reaching out to different areas. So maybe starting into a couple science areas that you're interested in. Maybe you have a neuroscience department at your institution that you really like neuroscience. So start there. Maybe you have a professor that you took a class with and he talked a little bit about his research. Go and visit that professor after class and say, hey, do you have any spots available in your lab? It's all about really reaching out to different professors in different departments and getting creative there. As far as clinical research, I think that can be a little bit harder to find sometimes. And Dr. Mehta, I'd love to hear your ideas on how people can get clinical research, but I think that also will involve being proactive, reaching out to university hospitals and different departments within the hospitals, if you have any teaching hospitals in your area. And then also if you're currently in some kind of clinical position, maybe you're shadowing or you're volunteering in a hospital, just use the connections that you're establishing there to ask about different clinical research opportunities that may be available.
Yeah, I think it's all about sort of using those connections and finding a connection. And sometimes that takes a lot of cold emailing, but I think you can be smart about it too. You know, I get emails all the time from students who are looking for research positions, but I just don't do a whole lot of clinical research myself. And so I can't accept them on, but I do have colleagues who do a ton and I know would be very interested in potentially having students help them out. So I think tailoring your search, maybe going on websites of specific departments and medical centers and finding a physician who seems to be doing a lot of research in the clinical realm would be something that's a good starting point, maybe. Mm-hmm. And that actually reminds me of another point, which I'd love to hear your thoughts on too, Dr. Marinelli, which is that I really like when students have research in fields that are actually outside medicine. And so obviously getting basic science research and getting medical research is great and definitely can make a huge contribution to your application. But there are students I've worked with who have had research in fields that are tangentially related to medicine, mm-hmm. right? So maybe they're doing public health type research. Maybe they're doing cultural diversity type research, right? Something that they can somehow relate back to medicine, but is not necessarily medical in its own nature. And I've actually found that this to be some of the best application fodder, let's call it that, because what happens is that these students can often sort of paint a really interesting picture of themselves as somebody who can do something beyond what other medical students do, right? They may have had these experiences that really relate to the overall theme of their application better than just forcing in a clinical research position. And they may have had the opportunity to present that research at different meetings, to talk about that research in national and international forums. I think it's great for people to really think above and beyond just the traditional medical research. I don't know if you have any thoughts on that.
No, I totally agree. And I haven't seen a lot of those applicants, and maybe that speaks to kind of the rarity of that type of research for pre-meds. But I do agree that the ones that I have seen, it really makes for an interesting application. And if you're not totally sure on like where to get that experience, start thinking about things that are related to medicine. Like you're saying, that maybe not in a typical science department. I've seen like psychology research, which can be really interesting. I've even seen like music research where people had studied different effects that music has on people. And you can, again, make the tangent jump over to medicine and kind of have its applications there. And you're still working through the scientific process and you're still thinking of a hypothesis and testing it and that type of thing. But it's just very atypical for most applicants. But also, as you said, it really shows your diversity and different perspectives, which I think can be very helpful when you're applying to medical school.
Yeah, I know. I think it's great. So if somebody's out there, if you guys are listening out there and want to think about doing some other research outside of medicine, go for it. I would say it can definitely make a big impact on your actual application. You know, another question that I get a lot is, how do I put this on paper, right? How do I put the research experience on paper so that it either looks good or at least it doesn't blend in with everybody else's research experience? And I definitely have some thoughts on that, but I'm curious as to what your thoughts are on that, Dr. Marinelli.
Yeah, so my biggest recommendation here is to really avoid the scientific jargon as much as possible. Obviously, you're talking about a research project. You want to give some information on what you do or what you did. But like you kind of mentioned earlier, you may not want to start it off as I worked with gene X374 studying the phosphorylation of catalysts, blah, blah, blah. Like, you don't want to
all the stuff that we don't even understand.
Exactly. You don't want to throw around just these really heavy scientific words that people are not going to follow. It's important to remember that lots of physicians will be reviewing your application to medical school, but lots of other people who aren't physicians or even in the medical field will be reviewing your application too, and they're also serving on admissions committees. So you want to appeal to a wide range of audiences. So if you're just using all this scientific language that no one's going to understand, they're going to just look over that research description in your application because it's not going to be significant to them at all. So try to make it understandable to the average reader. So I usually recommend maybe 1 or 2 sentences on what your project was. So, we studied an enzyme that could be related to documenting the activity of brain cells. I don't know. I just made that up, obviously, but very, very layman's term. And then the remaining part of the description should really be focused on what you actually did, like what type of lab skills did you learn, and kind of takeaways from that. You learned a lot of problem solving skills. You learned collaboration, teamwork, all of that type of things, rather than focusing on the specifics of your research project.
Yeah, I mean, I couldn't agree more. And I am a physician or a practicing physician, and I will tell you that so many of the basic science, particularly the basic science research write-ups that I see initially are so over my head. I have no idea what they're talking about. They're talking about some tiny little gene in some tiny mouse. And, students often feel like, well, if I use these big words, it's going to look impressive. It's actually exactly the opposite. I don't have any idea what you're talking about, and so I'm going to skim over it and not care. And so just like you said, what I really recommend my students do is I want them to use the first 2 or 3 sentences to describe to me the project in absolute layman's terms. Mm-hmm. Like anybody should be able to understand what you did. And then I also like them to include a little bit about how this may affect an actual patient, right? Because at the end of the day, a lot of basic science research may be 5, 6, 10 steps away from actually affecting a patient, but there's usually some sort of general vicinity in which that research is in. So for instance, in undergrad, I myself years ago did something about a mouse protein. And I'm being vague here, mostly because I don't actually remember what it was that I did, but it was something about a mouse protein. And I remember that in general, this same mouse protein was the same protein was inhibited in children with cardiac deformities or cardiac disease. And so that was kind of the clinical correlation. Now, nothing that I was doing in that lab at NIH was actually going to affect the patient for the next 10 or 15 years at the very earliest, but at least there was some correlation that I could draw to, so that when I went on interviews and sat across from a physician, I could at least give them some broad perspective on what that research was about. And so I think talking in layman's terms and connecting it to something within clinical medicine is the way I would approach it.
Yeah, I totally agree. And one thing to add there too, not only is putting it in layman's terms important for the reader, but it's actually a reflection of kind of your future skills as a physician. Because as a doctor, you're going to learn a whole new language, which is medical terminology. And when you talk to patients, you're going to have to put all of that knowledge into layman's terms. So you're actually like translating it to understandable, digestible material. And so if you start off in your medical school application with all of this scientific language that no one can understand, they're not going to think you're going to have that ability. But if you can put 2 to 3 sentences about summarizing what your scientific project is and make it understandable, that's going to reassure the medical school admissions committees that you're going to be able to do that also as a physician. And it seems like a minor point, but it is actually, a reflection of your abilities that you really, really need as a medical student and a doctor.
Yeah, totally agree. For students who are applying to research-heavy programs, there are actually essays that will ask about the research that they've conducted. And that's the only case where I think it's okay to get somewhat technical, because a lot of the labs that are reading the MD PhD applicants' essays are very technical basic science labs, and they will understand a lot of the stuff that these applicants may be talking about. But those are relatively few applicants, obviously. But I think that's the one exception that I do want to bring up for students who are writing about research, where you can get a little bit more technical, which is specifically if you're applying to MD PhD programs.
Yeah, that's a great point.
So for those of you guys who are out there who are in undergrad and thinking about a research opportunity, I mean, I think there's a lot of great opportunities to be had both during the year as well as over the summer, and then potentially during gap years as well. I mean, doing research was sort of the original gap year. Now we have all kinds of fancy things like SMP programs and scribing. But back in the day, people who took years off between undergrad and med school typically did research in some fashion. And so that's still obviously a very popular thing that students can consider, want to sort of improve their application in a way that will set them apart, particularly if you can get a few publications out of it, particularly if you can get a few presentations out of it at the end of the day. So that's something for those of you guys who are out there and thinking about how to spend a gap year, and for those of you guys who are earlier in the process and thinking about what to do during your undergrad summers as well as during the year. And so with that, I think we've covered a lot about research. For those of you guys who have additional questions, definitely check out perspectivedoctor.com and medschoolcoach.com, and we can help you sort through some of these questions in a little bit more detail. Dr. Marinelli, anything else to add?
No, I think that we kind of covered the basics of research and things to start thinking about. And I just want to emphasize one of your points too that you were kind of touching on is just trying to find a project, following it through, and then potentially getting a publication or a presentation can look really great on your application and make you stand out. So it's important to get involved early and continue with the project as much as possible.
Yeah, absolutely. So again, research is great. You guys are going to make some serious contributions to the world, to the scientific community, and perhaps even make a true difference in individual patient care. Now, a lot of research can be frustrating. It's oftentimes one step forward, two steps back. And so it's sometimes a little bit tough to get final answers and final conclusions. From an admission standpoint, we don't expect the undergraduate student to have cured cancer, right? That's not what we expect in a research experience. We know that's not going to happen. But for you to have some research experience, for you to have some grounding in the scientific process, in the knowledge it takes to come up with a hypothesis and execute an experiment to get to those answers, I mean, those are important skills that we're looking for. So thanks, everybody, for listening in this week. Stay tuned. Next week, we're going to have even more awesome information. And if you guys missed our podcast last week, we actually talked about secondary applications. So definitely check those out, particularly for those of you guys who are in the middle of applying right now. You're going to want to see those. And coming up, we're going to have a bunch of great podcasts talking about everything as a pre-med, whether it's MCAT, medical school, applying, extracurriculars. We got it all covered here. So make sure to hit subscribe and leave us a review on iTunes or Stitcher or wherever you get your podcast from. Thanks, everybody.
Great. Thank you.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at perspectivedoctor.com for more essential resources in your medical school journey.